Can long COVID symptoms become CFS? Have you ever wondered if long COVID can lead to myalgic encephalomyelitis or chronic fatigue syndrome? Research suggests that a significant number of people with long COVID develop symptoms that align closely with CFS. This condition is complex and often triggered by infections. It is characterized by severe fatigue that worsens with exertion, cognitive difficulties often referred to as brain fog, sleep disturbances, muscle weakness, dizziness, and headaches. Studies funded by the National Institutes of Health have analyzed thousands of adults and found that about 4.5% of individuals who had a prior SARS-CoV-2 infection meet the clinical diagnostic criteria for CFS. This is a notable increase compared to the much lower percentage seen in uninfected populations. In fact, this represents nearly an 8-fold increase in the incidence of CFS following a COVID-19 infection. This finding strongly suggests that long COVID can indeed lead to CFS in a significant number of cases. The overlap between long COVID and CFS goes beyond just symptoms. Research has shown that treatments that work for CFS patients often have similar effects on those with long COVID. However, it is important to note that the severity of illness and individual patient factors can influence how effective these treatments are, sometimes more than the specific diagnosis itself. Diagnosing CFS after COVID-19 can be quite challenging. Symptoms can fluctuate, and a careful clinical evaluation is necessary. Ongoing research is focused on understanding why some individuals develop CFS after experiencing COVID-19. This research aims to improve management strategies for those affected. From the perspective of chronic fatigue syndrome advocacy, these findings highlight the importance of recognizing long COVID as a potential trigger for CFS. It emphasizes the need for increased support, resources, and tailored care for individuals affected by these conditions. Furthermore, it underscores the urgency of advancing research to develop effective treatments for these overlapping post-viral conditions. In summary, current scientific evidence supports the idea that long COVID symptoms can evolve into CFS for a significant minority of individuals. This connection reflects shared underlying mechanisms and clinical presentations between the two conditions. Understanding this relationship is crucial for ongoing research and improving patient care efforts. If you or someone you know is experiencing these symptoms, it is essential to consult healthcare professionals for personalized advice and support.